Medications to avoid during pregnancy unless prescribed by a doctor. Take note that this information is just for educational purpose and you should seek out a health professional before making any decision. The first category of medications are absolutely contraindicated with the highest risk of severity. These medications are non-potent teratogens with a very high probability of causing severe birth defects, miscarriage, or fetal death. The risk of using these drugs during pregnancy almost always outweighs any possible benefits. The first example is thalidomide, which is used to treat multiple myeloma, a type of blood cancer, and skin lesions associated with leprosy. Thalidomide is one of the most infamous teratogens. Exposure during the first trimester, even from a single dose, can cause devastating and severe birth defects, most notably phocomelia, which is a severe malformation or absence of limbs, often called seal limbs, as well as a catastrophic damage to the eyes, ears, heart, and internal organs. The second is isotretinoin and other oral retinoids like acitretin, which is used in the treatment of severe cystic acne that is unresponsive to other therapies. This vitamin A derivative is an extremely potent teratogen. It carries a very high risk of miscarriage and severe life-threatening birth defects known as retinoid embryopathy, which includes major craniofacial abnormalities like small or absent ears, severe congenital heart defects, and central nervous system malformations like hydrocephalus, that is fluid on the brain. The third is methotrexate, which is used in the treatment of certain cancers, rheumatoid arthritis, and severe psoriasis. Methotrexate is a folate antagonist, meaning it blocks the action of folic acid, which is essential for cell division and DNA synthesis. Exposure during the first trimester can cause miscarriage and a pattern of severe birth defects known as methotrexate embryopathy, characterized by abnormalities of the skull, face, limbs, and central nervous system. The fourth is warfarin, which is an anticoagulant used to prevent and treat blood clotting. Warfarin readily crosses the placenta. Exposure, particularly between the 6th and the 12th week of gestation, can cause fetal warfarin syndrome, which includes severe nasal hypoplasia, that is a small underdeveloped nose, stippled epiphysis, that is abnormalities in the bone development, and central nervous system defects. Later use in pregnancy can increase the risk of fetal and maternal hemorrhage. The fifth is ACE inhibitors such as lisinopril, enalapril, and ramipril, which is used in the treatment of high blood pressure, heart failure, and diabetic kidney disease. While first trimester exposure risk is less defined, use during the second and third trimester is absolutely contraindicated. These drugs can cause severe and often fatal damage to the developing fetal kidneys, leading to renal failure, a drastic reduction in amniotic fluid, lung underdevelopment, limb contractures, and skull deformities. The sixth is ARBS medications such as losartan and valsartan, which is used in the treatment of high blood pressure, heart failure, and kidney disease. ARBS carries the same severe risk as ACE inhibitors. They are highly dangerous in the second and third trimesters, causing fetal kidney failure, oligohydramnios, and a high risk of fetal or neonatal death. 7 is valproic acid, used as an anticoagulant for epilepsy and a mood stabilizer for bipolar disorders. Valproic acid has a high teratogen potential. Exposure in the first trimester significantly increases the risk of major congenital malformations, most notably neural tube defects like spina bifida. It is also linked to congenital heart defects, fascial clefts, and long-term neurodevelopmental problems, including low IQ scores and an increased risk of autism spectrum disorder. 8th is ribavirin, which is an antiviral medication primarily used to treat hepatitis C. Studies have shown ribavirin to be a powerful teratogen causing severe birth defect of the skull, palate, eyes, and limbs. Due to this high risk, it is strictly contraindicated in pregnant individuals and their male partners. Pregnancy must be avoided by both sexes during and for at least 6 months after therapy ends. 9th is misoprostol, which is used in the prevention of stomach ulcer caused by NSAIDs. Misoprostol is a potent uterine stimulant that causes cervical ripening and strong uterine contractions. When used for its gastrointestinal purpose during pregnancy, it can induce miscarriage, premature labor, or uterine rupture. Note that this medication is intentionally used by doctors under controlled conditions for labor induction or medical termination of pregnancy. The 10th in this category is danazol, which is used in the treatment of endometriosis and fibrocystic breast disease. Danazol has androgenic effects, that is, male hormone-like effects. If taken during pregnancy, it can cause virilization of female fetus, leading to ambiguous or masculinized genitalia, including clitoral enlargement and labial fusion, which may be irreversible. The second category of medications have a high risk and are generally avoided if possible. These medications have a strong evidence of causing harm to the fetus. They are avoided unless a safer alternative is unavailable, and the medication is deemed essential for the pregnant person's health by a specialist. Example under this category is statin such as atorvastatin, simvastatin, which is used to lower high cholesterol level. Cholesterol is a fundamental building block for fetal cell membrane, hormones, and overall development. By inhibiting cholesterol synthesis, statin could theoretically disrupt these critical processes. Due to this potential for harm, they are generally discontinued before or as soon as pregnancy is discovered. 12 is lithium, which is a mood stabilizer used for bipolar disorder. First trimester exposure to lithium is associated with an increased risk of a rare but serious congenital heart defect known as Epstein's anomaly, where the tricuspid valve is malformed. 13. High-dose fluconazole. Fluconazoles are antifungal medications used to treat serious fungal infections. While a single dose is not strongly linked to defect, chronic high dose used in the first trimester has been associated with a distinct pattern of birth defects, including craniofacial abnormalities, cleft palate, and heart defects. 14 is metimazole, which is used in the treatment of hyperthyroidism. Use in the first trimester is associated with a group of birth defects known as metimazole embryopathy, which can include scalp defects, esophageal atresia, and fascial abnormalities. Propylthiouracil is often preferred in the first trimester. EGOT derivatives such as ergotamine, which are used in the treatment of acute migraine headache. These drugs are potent vasoconstrictors, that is, they narrow the blood vessels, which can severely restrict blood flow to the placenta and fetus. This also stimulates uterine contraction, creating a high risk of miscarriage and premature labor. The third category of medications have significant risk and are used with extreme caution. These medications carry non-risk, especially during certain trimesters, or may cause neonatal complications. Safer alternatives are strongly preferred. First under this category are the NSAIDs such as ibuprofen, naproxen, and diclofenac, which are used to relieve pain, reduce fever, and inflammation. These should be strictly avoided in the third trimester. Their use can cause the premature closure of a vital fetal blood vessel called the ductus arteriosus, leading to potentially fatal fetal pulmonary hypertension, that is high blood pressure in the lungs. They can also decrease amniotic fluid and inhibit labor. 17 is tetracycline antibiotics, which is used in the treatment of bacterial infections such as acne and Lyme disease. If used after the 4th month of pregnancy, tetracycline can bind to calcium in the developing fetus. This can result in permanent yellow-brown discoloration of the baby's teeth and may inhibit bone growth. 18th is benzodiazepine, which is used in the treatment of anxiety, panic attack, and insomnia. Use, particularly in the 3rd trimester, can lead to floppy infant syndrome, where the newborn suffers from poor muscle tone, lethargy, breathing difficulties, and poor temperature regulation. The baby may also experience withdrawal syndrome after birth. Fluoroquinolone antibiotics such as ciprofloxacin and levofloxacin are used in the treatment of various bacterial infections. Studies have shown that these drugs can cause damage to developing cartilage and joints. While human data has not definitively confirmed this risk, they are generally avoided during pregnancy due to these concerns, and safer antibiotics are preferred. The last is pseudoephedrine, which is an over-the-counter oral decongestant. As a vasoconstrictor, there are concerns it could reduce blood flow to the uterus. Some studies have suggested a small association between first trimester use and an increased risk of gastroschitis, a birth defect where the infant's intestines are outside the body. Saline spray are much safer alternatives. We have come to the end of the video. Like, subscribe, and comment your thoughts in the comment section.